A 21-year-old woman is brought to the emergency department after her roommates discovered her unconscious in her room with an empty bottle of pills next to her. The patient is treated with activated charcoal and is currently stable. When the physician attempts to communicate with the patient, she is at first silent but then only responds with that she does not want to talk about her suicide attempt. Which of the following statements is the best next step by the physician? Choice A, I know it may be difficult, but please tell me how you're feeling. Choice B, would you like to speak with a psychiatrist? Choice C, I understand you are in pain, but I can't help you if you don't communicate. Choice D, suicide is a common issue in women your age. Do not feel ashamed to speak up. Or choice E, are there any friends or family you would like me to contact for you? I'll wait 5 seconds and answer the question. So here we are with another ethics question with a fairly obvious answer choice. I say it, and most resources will tell you this, but you are supposed to pick the answer choice, but probably 9 times out of 10, the one that says, tell me how you're feeling. So choice A is the correct answer. And once again, let's go through our principles, which is, of course, you got to ask open questions. Don't ask yes or no questions. Invite the patient to express their feelings. Don't be judgmental. Pretty typical stuff, right? So let's look at the wrong answer choices here. Choice B, would you like to speak with a psychiatrist? This is not only a closed-ended question, it's a yes or no question, but it also doesn't address the patient's immediate concerns. And as I often say, any answer choice where you refer the patient to somebody else is usually going to be wrong. So this answer choice is just wrong in multiple different ways, right? Choice C, I understand you are in pain, but I can't help you if you don't communicate. This is probably overly aggressive / confrontational. Also, any answer choice where you make yourself the subject or the main focus of what's being talked about is usually a really bad idea because it just means you're more concerned about getting your job done than you are about the patient, if that makes sense. Choice D, suicide is a common issue in women your age. Do not feel ashamed to speak up. This is almost like minimizing the patient's feelings or their concerns, right? Now, I know some of you will think that, well, sometimes in real life, maybe this would actually work. Maybe, but USMLE is looking for very specific answer choices. Choice E, are there any friends or family you would like me to contact for you? This is one of those sounds reasonable, but is actually a bad answer choice for a lot of different ethics questions, because they want you to understand the implication that you are not sure what the patient wants. You don't know if they want their family here, so you don't want to make this offer right away. And very similarly, you want to be careful of making similar kinds of suggestions when there is more than one person in the room. Maybe slightly off the topic, but basically they want you to have it in mind that there's a possibility of not just the patient wanting to keep their health status private, but also the possibility of stuff like abuse. That's not relevant in this question, of course, but what I'm saying is that they do test you on basically your situational awareness in these questions a lot of the time. So bring it back, typical ethics question, right? Gotta ask how the patient's feeling, okay? Pretty standard rule of thumb. Hope you found this video helpful. I'll see you in the next one.